Good afternoon, good morning, ladies and gentlemen. I'm Islam Adra, Chair of IOSH UAE, and welcome to our first virtual branch meeting. This is the new norm, the new reality. Now, as many of you know, we have had an amazing lineup of events in store for you in March, April, and May. We had our second Women in Safety event, a mega conference in Sharjah, a couple of CPD events, some CSR activities, and some other initiatives as well. But we have had to cancel those because of COVID-19. So unfortunately, this is the last event of this committee's term. Now, we wanted to end with a big bang, but unfortunately we can't do that anymore. So we decided to end with at least some form of bang with this branch meeting. So we've strived very hard to get some very high caliber speakers for you, and we have the President of IOSH as well as one of his VPs that will address you today. So let me give you a rundown of what you can expect this afternoon. I'm going to introduce Professor Dr. Andrew Sharman, who will deliver a presidential address to you. He will then introduce Tim Eldridge, who will talk to us about mental health and COVID-19. I'll come back and I'll moderate the Q&A session, and we will seal the deal with the annual general meeting. Now, before I dive into the meat of the issue, let me give you a bit of housekeeping tips. Now, on the top left-hand screen, on your top left-hand corner, you should see a bar with chat and Q&A. Now, if you are having audio difficulties, you can click on the chat and let us know, and we'll try to assist you as fast as possible. If you have a question pertaining to the contents of one of these presentations, then please type them into the Q&A session, and we will address them in the Q&A session later on. If we run out of time and your question is not addressed, we will try to address them on a platform that we will make available to you. Now, without further ado, let me introduce my first speaker this afternoon, the President of IOSH, Professor Andrew Sharman. Now, Professor Andrew Sharman is a fellow. He served IOSH for many years. He's served on a presidential team. He's been as a secretary as well as a vice chair and chair for the Edinburgh branch. He's a professor at several universities. He's written some books, and he's given countless talks, including a TED Talk. So without further ado, please put your virtual hands together for Professor Andrew Sharman.
Thank you, Islam. Thank you, everybody, for your welcome here today. It's a pleasure to be with you. Islam said that he wanted a big bang for this meeting. I think you've already got it. You've created it yourselves. I can see 195 participants on this Zoom webinar. That in itself is one of the biggest bangs I've seen on Zoom in any branch, network or group over the last few weeks of the pandemic, whilst I've been talking with as many branches and groups as I can for IOSH. So congratulations to you for creating the big bang that you were setting out to do. I just wanted to address you as your president with a note of support, really, as we try to cope as well as we can through this unprecedented challenge as the pandemic continues. COVID-19, the coronavirus, has and still is continuing to disrupt our lives. We're having to isolate ourselves, distance ourselves from family and friends, work in different ways, and not being able to engage or interact in the ways that we used to. And it really is quite unsettling, isn't it? From a personal perspective, I too have found myself in that situation. I normally live in the country of Switzerland. A quick 4-day trip to visit my family back here in Scotland, my homeland, has turned into 6 weeks now here with just a weekend bag worth of clothes. I've been locked down in Scotland, away from my home, away from my friends and family, and I'm fed up of living out of a suitcase in an Airbnb rental apartment and not being able to go and see my family. In addition, I managed to pick up the coronavirus and have been quite sick with that over several weeks. And thankfully, I'm recovering now and pleased to be with you today. I thought there was a light at the end of the tunnel for me with a flight back home to Switzerland booked for next Tuesday, the 19th of May. But that flight was cancelled by the airline, and I received a letter to say the earliest that I can get back to my home in Switzerland is middle of July now. Like many of you, I've had enough of this pandemic and the cabin fever is setting in. But I guess all we can do is be patient, which, as some of you may know, is something that doesn't come easily to me. Despite all said, we've got to take away the positives and embrace the time that we have to spend with those that we love, to find ways to strengthen social connections with other people through things like these webinars and video chats, or phone calls and letters and social media connections too. Over the last few weeks, I've found myself writing handwritten letters and cards to people that I realize that I probably have lost a bit of touch with, but they're still very important to me in my life. So I just wanted to reach out and say hello to them. I've received letters and cards back and notes on emails and small gifts from friends and family that I haven't heard from for a while too. And these things really pick me up and make me feel like I'm part of something much bigger rather than sitting here on my own in a rental apartment. And of course, social media is everywhere, isn't it? But there's a balance. We can get too much news. I think one of the biggest risks from the pandemic right now is the infodemic that accompanies it. I'm trying hard not to watch too much news or read too much news at the moment, because what's clear to me is that we really don't know what the future looks like yet. I'm hosting webinars every second week for IOSH with the World Health Organization and the United Nations, and the experts there in those organizations tell us every day is a day for learning. We don't really know what we're supposed to be doing next. So taking in all of this news that surrounds us, I think fuels anxiety more. So we need to be careful about what news we are paying attention to, stick to the facts, and try not to overthink this. I guess we're all finding ways to cope and understand what the pandemic means for us and what our role is in all of this, whether it's as a husband, a partner, a wife, a brother, sister, father, mother, friend, colleague, co-worker, or other. You know, for me, if this period of the pandemic has taught us anything at all so far, it's taught us the importance of human connection. In many countries around the world, governments are talking about the need for social distance. But I think that's a misnomer. It's not social distance that we need right now. I think it's physical distance. We need to physically separate ourselves from other people to reduce the risk of spread of the virus. But what I'm seeing right now is that social distance is reducing. Here I am today connecting to over 230 of you through this simple webinar technology. We're creating these social connections. They're not physical, but they're very important and very social indeed. One thing that's very important to me as your president is the work that you do. It's never been more important than right now that our profession has an opportunity to come right to the fore in this pandemic and show how important and how valuable IOSH practitioners really are for organizations and for communities and societies too. I recorded a short message recently, which you may have seen, where I spoke about all the amazing efforts of health and safety professionals around the world. Nearly 48,000 of us here in IOSH in 130 countries now. Those working from home in different unusual environments with families and kids at home, we're all joining forces as one to ensure that we and our membership remain strong. And it's a real honor and pride for me to be your president, particularly in these turbulent times during the pandemic. You can listen to that video message, which is being dubbed my co-video, on the IOSH Coronavirus Resources page. You'll find it at iosh.com/coronavirus. In that video, I also spoke about the IOSH Benevolent Fund. Many of our members may be facing hardships during this challenging time, and that's where the IOSH Benevolent Fund could really offer a lifeline of financial or other support to members who are struggling. And I encourage you to take advantage of this if you find yourself in that situation or know of someone that needs a little bit of extra support right now. To find out more about the Benevolent Fund, just go to iosh.com/benevolent fund. To show our support, every member of the IOSH presidential team has donated to this vital fund, and we'd appreciate all other contributions, no matter how small they may be. Every pound can help one of our members. So if you're able to do so, please consider boosting the fund to help your fellow colleagues. Donating is simple. It takes just a couple of minutes by credit card online at iosh.com/how-to-donate. It goes without saying that we'll all be feeling somewhat anxious by the changes that we're experiencing. And to address this, I'll soon hand over to Tim Eldridge, one of our vice presidents, who will present a session on how our mental and physical well-being can be affected in these difficult times. And also how we can mitigate those effects and boost our well-being and resilience. I really hope that each of you takes something away from that session with Tim today. During these difficult times, it's important to remember that the little things we do often makes the biggest difference. So look out for one another, your loved ones, your friends, your neighbors, your colleagues. Recognize and thank those that are working throughout this period. Whether it's the key workers, those on the front line, or your colleagues in your organization. A phone call, a letter, a video call, whatever you can do to stay connected, I'm sure will be appreciated right now. We're all on this journey together as one IOSH. That's how we'll succeed this virus, as one IOSH. I'm sharing my journey each week in my LinkedIn posts that I'm calling The Life of the IOSH President. And I encourage you to get involved in the discussions there. I'm trying to post an idea that's on my mind and stimulate discussion and sharing of experience. And I've been so impressed with how many of you have contributed to those discussions. Thousands of people in some of these dialogue threads. As I said at the beginning of my message, right now is the moment that our profession can really shine. The profession has never been more needed and never been more important, in my view. I really believe that we'll look back at this moment in time, in years to come, and say, that's when things changed. That's when we were recognized as a profession for the value that we bring. IOSH will continue to keep you updated and support you through this challenging period. So keep an eye on the IOSH website, particularly that coronavirus resources page, where you'll find a stack of resources that's updated on almost a daily basis. In the meantime, thank you for your time and your attention, for the invitation to come and join you and talk with you today. I wish you and your loved ones the very best. Take care of yourselves and don't forget to make time for yourself and your own well-being too. It's easy right now when we're all under pressure and being demanded every day to help and support others to forget about ourselves. Know that I'm thinking of you. I'm grateful for you as members of the world's leading body for IOSH practitioners and for your attention today. Thank you very much. It gives me great pleasure now to be able to hand over to one of my vice presidents, Tim Eldridge, who's going to talk a little bit about the ideas of mental and physical well-being and mitigating the effects of the coronavirus in order to boost our resilience. Tim, over to you, please.
Thanks very much, Andrew. It's great to hear from you and echo every word that you've said. Secondly, to Islam and the whole of the UAE Branch Committee, thank you very much for inviting me to come along. Very honoured to be able to join your branch today and to see how many participants you've got, which is fantastic. Just very briefly, a little bit about me. So, I'm one of your vice presidents. Have been. This is my second term of office. Second year of office as vice president. Interestingly, we're going to talk about COVID-19. We all have so many stories to tell, and listening to Andrew, I mean, some of the reality of how we've all been touched by the coronavirus is really quite impactful, isn't it? my background, my day job, I'm the head of health and safety for a global bank, and that global bank is significantly operational in China. So I do remember very early on in January, one of my colleagues phoning me up, I think it was the second week of January, saying, we may have a slight problem over here in a place called Wuhan, which I'd never even heard of. There's this virus that may be causing a bit of a problem to our branch in Wuhan, as the bank had a branch there. And we did what we did, and we supported our colleagues over in Wuhan. Little did I know in the middle of January that by the middle of May, how this whole event would have panned out. And I'm sure that every single one of you have got similar stories to tell, both personal and professional. So what do I want to do today? Really today is give you an opportunity to have a conversation around some of the aspects of coronavirus that perhaps are sometimes missed. Of course, we focus very much on the physical health of people during this time, and the impact that the virus has on individuals, on communities, on loved ones. But there's also other impacts, of course, that the coronavirus, COVID-19, has been having on us all. And today's an opportunity to talk a bit through that. And what we've done as a presidential team, and we all talked together and all gave our own individual stories as well. And we thought it'd be great to come up as a team with a bit of a reflection for all of our members on some of the aspects of the psychosocial issues that people are facing when it comes to COVID-19. So today, I'm not an expert. I'm not a psychiatrist. What I'm here to do is hopefully give you, our members, a bit of some basic information to help you protect yourselves, your families, and obviously take out into the organisations that you support as IOSH practitioners. And hopefully, by the end of this brief presentation, you'll be able to understand really and describe the negative spiral of psychosocial issues that can happen at times like these, and when we as practitioners can reach out and can encourage others to reach out for psychological or social counselling assistance. So what am I going to talk about today? The topics I'm going to cover are the various stages of prevention. I'm going to talk about the 3 variables that determine stress, and the risk of COVID-19 in that, and as I said, the negative spiral of these multiple psychosocial issues, and how we can break that chain of causation when it does happen. We're going to have a couple of polls. Really keen to hear what you think. So I'd encourage you all, hopefully you've all had a poll pop up on your screen. So first question is, do you feel anxiety or stress due to the current situation? Don't overthink this, please. Just go with your immediate response and think about how the coronavirus situation has been impacting you. So please vote, and then we'll hopefully have some results coming up very soon. Here we go. So, and not a huge surprise to me, hopefully not a huge surprise to you also, but there we go. 7 out of 10 of us are feeling some form of anxiety or stress due to the current situation. So clearly the topic we're discussing today and having that conversation is really important, both for us personally, but also as practitioners when we go out and talk to other people. So we know that, that from the science of public health, that really there's 3 levels of prevention. So the primary prevention, of course, is keeping people healthy. Then we go into the secondary prevention. So when people do start to show indications of a problem, whether that be a physical problem or a mental health problem, we need to start thinking about mitigating the effect of that. But then thirdly, when people are ill and people then are suffering from any particular physical or mental illness, then clearly we need to provide that support. And I think in thinking about those 3 levels of prevention, what's our role? Well, I believe our primary role is to keep ourselves healthy. So the primary prevention, of course, we always need to focus on that. But as we've just seen in that poll, that's not always possible. And 7 out of 10 of us are saying we're struggling with that primary prevention. So with the current situation and the stresses, our next goal is really to try and mitigate the effect when we do show we are showing that we have a problem. And then if we go through that second stage and get into this tertiary stage and we do have problems, we really need to to find what the mitigation strategies are and make sure they are successful. And if they're not, then where do we go for additional help? So you can see on this slide the 6 priorities of IOSH, that clearly what we're talking about today is absolutely embedded in our 6 IOSH priorities. And that is maintaining our physical and mental well-being. So in developing this presentation, we've looked at a lot of the research around this, and I'm sure many of you are familiar with that. And this particular slide relates to some research by a prominent researcher in the area of stress at work, a gentleman called Robert Karasek from the University of Massachusetts. And in his research, he demonstrated that stress can be demonstrated by 3 variables. So the reason this image is up is you've got 3 variables there, and as you can imagine, they can be moved up and down on that machine. So what are those 3 variables? We've got a person's or individual's perception of demand. So what's the demand on them? What's being asked of them? Their perception of control. So how much control do they have over that demand? And an individual's perception of social support. So what's the framework and what's the environment around them that can help them in managing that control and demand? So for example, when the demand is perceived as high, so you can imagine sliding the demand button up to the top, and the control is perceived as low, and particularly where there's a lack of social support, that is when stress will happen. And that will almost certainly end up with some form of negative health outcome. That may be mild, but that could also be quite severe. So although Karasek's model focuses on workplace stress, this is also really applicable to the current situation we're in with the COVID pandemic. If you think about it, fearing the outcome of the virus translates into a perception of high demand for good health. So that demand, we demand good health as individuals, but our fear of that and the impact of that really does affect us at this time. And how much in control are we? I'm sure you've all got views on how much in control are you of your ability to stay healthy and well during this time. We have, obviously, we're very aware of all of the restrictions. The good controls are in place, whether that be around the distancing, good hygiene. But of course, the level of control we have isn't complete. And as Andrew shared in his story, and also I know many other people who have been unfortunate enough to contract the virus, that our levels of control are very low when it comes to this particular situation. And then just moving on to social support, and if Andrew doesn't mind, I'll just use his example as well. Our ability to interact with our environment, with people, if we don't have that ability, that's a lack of social support. So Andrew spoke about, the feeling of isolation he has being away from family, friends, and home. That social support is low. The control is low and the demand is high, and therefore you can see how very quickly people can come into starting to get some negative outcomes at this time. Now, hopefully, this is a diagram we all recognise. So, as IOSH professionals, we're very used to calculating calculating risk and using the 5x5 matrix of severity and likelihood. And of course, we can use this in the current context. So, what is the risk level when it comes to the psychosocial risk during this outbreak? And do we think it's acceptable? Do we think it's tolerable? Or actually, do we think in that high risk category? Now, of course, it'll be different for every situation, but I think when we talked about those three variables, the demand, the control, and the social support, if those buttons are in the wrong place, then clearly we can see how that risk can move into the not acceptable level. This year, the year 2001, so let's just go back a bit into 2001, marked the ILO, so the International Labour Organization's entry. They came into the area of stress at work, and they created a flagship program called SOLVE, S-O-L-V-E. And in that model, the ILO described the factors by which stress could trigger one or more negative outcomes, or in fact, any or all of the negative outcomes that could trigger stress. And what they said is this could lead to a negative spiral or a negative synergistic effect. So you've heard me speak a little bit, quite a few times now, about this negative spiral. Hopefully in the diagram you can see what we mean by that, and you think about the whirlpool. And when you start moving in the direction of the water in a whirlpool, it's going to be very difficult to get yourself back up again. And of course, the more factors in that diagram impacting you, the more you'll be in that spiral, and the more difficult it will be to come out of it. And indeed, already in going back to the current situation, I'm sure you've seen reports in the media that there's been a surge in domestic violence, and there's also been, reports of acts of discrimination also on the increase. So we're actually absolutely seeing how that is happening at the moment. So moving on to the next slide. Here's some. Sorry, I just go back again. Bear with me. Apologies, Carrie. So there are some possible outcomes that can be a source of stress. And what I'm going to do is show you a few of these examples in the slide. And what we're going to do is launch the second poll. So I'll just click up the second poll, and Carrie will launch that. And then as you're doing the poll, I will bring up the factors, and you can see which of those you feel are relevant in the poll you've just been asked to complete. So in your current situation, how many of these outcomes do you feel you are experiencing? So what we've got there, we've got stress, people experiencing inadequate exercise, we've got addictive behavior, social insecurity, financial insecurity, inadequate sleep, inadequate nutrition, and violence. So just, again, don't overthink this, but just quickly, if you could identify those that come up the most from you, and we'll be interested to see what the results say in a second or two. And I'm sure some of these are very familiar to you, to many of you. So we'll just give it, there we go. Okay, so here we go. So let's have a look at this. So we've got only 4% experiencing none. So, and again, I don't think any of us will be surprised by that. So we've got 24%, so a quarter of us are experiencing more than four or more, more than four, so 5 or more of those those outcomes. And then you can see, the majority is at 3, and they've got 15% of 4. So, again, I'm not surprised by that. I'm sure you're not. But it does indicate that for all of us on this call who are impacted by this situation, that we are having negative outcomes already, and some of us, and in fact 1 in 4 of us, are having 5 or more of those negative outcomes. So what do we do about it? So there was a recent communication from the World Health Organization that suggested that The constant news reports about the current situation can lead to feelings as anxiety and distress. And of course, Andrew touched on that, didn't he? And talked about how following every single piece of news, whether that be on the broadcast media, in the printed media, or more frequently these days in social media, can lead to levels of heightened anxiety and just distress. So what do we recommend, and what should we be recommending to our colleagues and our organizations? Well, what we would say is, really, let's focus on the trusted, the proven sources from those reliable sources of information that we can. And clearly the World Health Organization is one of the best organizations to go to, and there are a number of other public health authorities around the world that we can lean on. And I would also certainly recommend the European Centre for Disease Communication, and it's excellent at this time to provide really trusted and tried and proven information. And of course the CDC in the US, which also does that. But wherever you are in the world, your national health authority will have be available for you to be able to provide that kind of information for you. And of course, what's the one source of information that I haven't yet mentioned, which we're all members of, which of course is IOSH, and I'll talk a little bit more about where we can go within IOSH to find more information, which really is probably one of the best sources of information for us to break this chain of causality. So the World Health Organization as well proposed 7 important roles of the occupational safety and health professional during the COVID-19 pandemic. So there are 7, and you can there's a reference later for you to find out what all of those 7 are. But I'd just like to focus on 3 of those, which I think are really important roles for the OSH professional in this time. And those are assessing risks, providing risk communication and engagement at workers with psychosocial support, and collaborating with the community and public health authorities. So looking after yourself as well is an increasingly important part of it. If we are going to be giving that advice, that information, and that support to our organizations, it's not going to be very helpful for us to do that if we're not looking after ourselves. We've got some really interesting and useful and helpful advice from IOSH's own head of health and safety in a recent webinar, who suggested that on a personal level, we need to focus on ourselves and others by looking after and listening to our own mental and physical health and well-being. So how many of us are doing that? You know, the old phrase, we should practice what we preach. And I do wonder that now more than ever, as OSH professionals, we should be looking after ourselves with physical exercise and mental exercise as much as we encourage others to do it. Looking after our own safety and health. So of course, if you're anything like me, you're spending a lot of your time advising your organization or organizations on how to look after themselves and be safe and healthy at this time. And again, all the controls and all the things that I'm talking about with my organization on a daily basis around PPE, around hygiene, around distancing. And I've had more conversations about how many people you can get in a lift when you're 2-meter distancing. That's probably healthy, but we're doing that. But are we looking after our own safety and health at the same time? I talked about the 3 risks roles of the professional, about the assessing risks, and we covered that earlier. But that risk communication, are we really giving the right and most up-to-date information out? And is that because we are sourcing that information in the right place? And again, I mentioned earlier, where are we going for that information? So it's important as professionals, and as OSH professionals, we spent our entire career keeping up to date with the most relevant information about safety and health, and now is no different. So let's keep up to date with the most relevant information. Let's use IOSH and the Public Health Authority sites to do that, and let's avoid the misinformation and fake news. And then the third role I spoke about is the collaborating with community and public health authorities. How are we collaborating? How are we talking about how we're feeling? Are we encouraging people to talk about how we're feeling? And I think Andrew made a really important point about the term social distancing, which, like it or not, sorry, I've just gone too far, I'll go back. So like it or not, social distancing is the term being used. But I agree with Andrew, it's probably it's an unfortunate term that's now become part of the modern vocabulary, because it's, you know, that social interaction is so important to be able to stop that spiral of the outcomes that we talked about before, of which a quarter of us are feeling 5 or more. So, you know, this is a great way, and it's fantastic that, you know, so many members are able to attend a branch, this branch meeting that normally would, you know, would all be, you know, you'd all be meeting in Dubai or Abu Dhabi or wherever it is, face to face, and having that social interaction. We can't do that now, but we need to continue this, and I'm just so delighted to have all of you on the webinar today. So I'm going to finish by just confirming that we've developed a information sheet. So you know, I've been reasonably quick on this webinar, and I think that was important that I was quite quick, because, you know, again, for your well-being, listening to someone like me for 45 minutes, I'm sure is going to be very helpful. So we've summarised what we've got to say in just a nice one-page information sheet, which really clarifies that your well-being is important in caring for yourself and, importantly, for others. It also, you know, flags the fact that if you feel you're losing control and you're feeling overwhelmed by events, then you must seek support. So, you know, I'd say the quarter of us who responded that I've got 5 or more of those outcomes, you know, let's look for support on dealing with that. And that support can come from your family, your friends, your colleagues, but of course it can also come from professional help from a psychological or social counsellor. So this is an information sheet not just for you as participants in this webinar, but you'll be getting a copy of this, and you'll be able to share it with throughout your organisations and be able to use it to spread the message, the very brief but hopefully helpful message that I've just shared to you today about our principles of risk management, our understanding of hazard and risk, you know, applies as much now in the COVID-19 situation than it's ever done in any of our previous career. And also it's about that mental and physical well-being, and how we recognise that as a workplace hazard and a real hazard at this time, and a risk, and how we may manage that. So I did mention further information, and again, this will be you'll have access to this following it. But of course, IOSH, you know, without a doubt, one of the best places to go. That the team at IOSH who support us have done so much fabulous work in developing all of this information, and I must thank them on behalf of myself as a member, and all of you for the work they've done. And then I briefly mentioned the WHO and the ILO, and of course also the other public health authority organisations that you've got. So that was my very quick, brief run through, and in fact, and importantly now, I think that it would be good if we are able to take some questions and answers for you. So Islam, I'll hand back to you, and thank you very much.
Thank you very much, Tim, and thank you very much, Andrew, for the presentations. Very much appreciated. So we've got a couple of questions on the Q&A chat box. So the first one is about employers expecting too much from OSH professionals. How can we respond to this when, you know, our leadership teams are expecting us to know the answers, expecting us to know what to do, when really globally, you know, everybody's at the same place when it comes to answers?
That's a really good question. I'll answer that in 2 ways. And if you allow me to be a little bit cheeky, I'll answer it in a positive way. from my own personal experience as well, I have never known the IOSH profession have more importance, more visibility, and more respect among senior leaders than it has at the moment. And I am immensely proud of the work that my team are doing in the bank, but also that IOSH are doing. And IOSH is all over being asked all over the media to comment. Me and my team are at the forefront now of conversations that I would never have dreamt people would have even asked, probably didn't even know we existed, to be honest with you, never mind asked us to participate in conversations. So I think that's a real positive, and we as IOSH professionals should celebrate that. And of course the challenge then is maintaining that when all of this, all of this dies down. But of course, yes, absolutely, that does lead to pressure on us as professionals, as we're seen as a go-to person often by our senior leaders for answers. And I'll be really clear about that. And I've been really clear in my day job. We don't know all the answers. And just as much as when it comes to, let's say, an accident investigation where there's been an accident with a piece of equipment that we've never seen before, and we're not, structural or civil engineers, what do? We go and seek the best advice. So my best friend over the last 4 months has been my expert medical advisor, who I speak to on a daily basis and provides me, and says to me, Tim, there's no such thing as a stupid question. And trust me, even today, I was on the call before this webinar to him, and I was asking about, what do you do about cleaning the inside of cars? And I'm thinking, well, should I know that or not? I mean, should they expect the global head of health and safety to know the answer? Well, at the end of the day, I don't. The reason this disease is called the novel coronavirus is because it's new, and so many people don't know. So please, be present, be encouraged by the fact you're being asked questions, and celebrate the fact you've got visibility, but always feel comfortable to say, because of the nature of this illness and this virus, and because it's changing all the time, I can't give you an answer straight away, but I will go away and come back. Andrew, I don't know if there's anything you wanted to add to that.
Yeah, Tim, you make such an important point here about the value of IOSH professionals. As I said in my opening address, now is the time for us to shine. And the fact that the question is, what do we do when we're being asked expected to answer every question? I think that's an indicator of how important we're being seen by leaders in business right now. In fact, I just wanted to add this comment because I need to leave and go straight into another webinar where I'm talking to the Institute of Directors on COVID-19, and I'm their sole guest on this webinar as part of their weekly update series. And I just got a note from the organizers to say over 500 senior leaders and directors are joining that webinar, which is twice the amount that they normally have on their weekly events, which is phenomenal. And I think my suggestion to participants here on this call as IOSH professionals is to start infiltrating these leadership gatherings. So any of you that are available, it's at 1 o'clock UK time, so that's in an hour and 15 minutes. You can find details and register for the IOD webinar on my LinkedIn profile. I've just sent you a link to how to find that. And you can come and join this webinar and start mixing in here and bring the voice of our profession to those voices of directors and senior leaders. Don't be afraid to say, I don't know the answer to this question yet, but I've got a good idea on where I'm going to find the answer, and get into some of the resource pages that Tim has shared with you in that excellent presentation. So I just wanted to offer that, and also to express my thanks, Tim, to you. I thought that was a phenomenal presentation. Very well done. Thank you very much. Islam, thank you for your welcome and your invitation. Thank you all for your attendance. I'll sign off and leave you to the rest of the questions now. Thank you again for having me.
Thank you, Professor. Thank you. Tim, I know you mentioned this during your slides, but can you recap on some of the relevant resources people can use to inform themselves about COVID-19 and if they need to write SOPs for their companies?
Absolutely. So, and there are, I would say, probably 3 or 4 really go-to sources of information. IOSH, of course, and what IOSH isn't obviously providing medical expert advice. What IOSH has done has taken that medical advice and translated it into practical advice for us all about how we can use that to support the organisations we either work for or we consult to, or even ourselves. So absolutely, please first stop shop IOSH. Then, of course, I think there is a lot of uncertainty about the medical and scientific aspects of this disease. Even, for example, Mike, again, conversation today is if you do an antibody test and it proves you've got antibodies for coronavirus, does that mean you're immune? Well, I can tell you now that the global scientific evidence just does not exist. So if someone's telling you and trying to sell you an antibody test to saying, this is your silver bullet, this will save all your problems, say, thank you very much, listen to them, but then go to these organizations, to the World Health Organization, to the European Center for Disease Communication, and for the US Center for Disease Communication. Those are the three that I found the most valuable. That's not saying that the other national health authorities don't provide great information, they do, but those are the three I'd absolutely recommend.
Perfect, thank you so much. I guess maybe you can recap again, there's been questions about the IOSH membership fee. Maybe we can talk about the benevolence fund and
yeah, so just back to the benevolent fund. Of course, you'll all be aware that we've had the benevolent fund now for many years, and it's a fund that we hold for members who have difficulties for whatever reason that may be, and need some financial support, whether that for whatever reason that may be. And we've always had that fund, and what we want to say is that we recognise now that our membership are probably often in a group of people who may well be struggling financially to make ends meet because of what the lockdown has created to their business and their personal situation, whether they've been made redundant or they work for an organisation that's effectively closed down, or that they are individual consultants who just, that their work has disappeared. If people are struggling, then please go to the IOSH Benevolent Fund, apply, and that will be go through the obvious process. But also for those of us who are fortunate enough not to be in that situation, then we can actually help by adding to that fund by donating, and it's a charitable fund. So if you donate in some countries in the world, you can also get the government to pay tax on that donation for you as well. And all of the presidential team have recognised that we want to support our members and made a donation as well. So on the IOSH website for the benevolent fund, you've got the links to both donate, but also to ask for support if you need it.
Thank you, Tim. Well, one question that I'm seeing all over again, and a concept that's really coming to light now, is return to work. I know for myself, return to work is a big thing now at work. Several questions that have come up. Where can we find resources, and what's your 2 cents on return to work and whatnot?
Okay, really good, and a really good question, because yes, that's dominating my professional life at the moment, as I'm sure many others. But just interestingly, because I'll just go back to my day job in the bank. For example, we've got several thousand employees in China who actually are nicely back at work and functioning very happily. We'll be slightly jealous to know, through to the tens of thousands of employees in the Middle East, in Europe, and of course in the Americas who aren't. So the first thing I would say is, once the restrictions are lifted, this is not a race back into the office. The worst thing any organisation can do is go, hooray, we are now allowed to go back to the office, everybody piles back in. The best advice, be really clear to people who are making these decisions as professionals, that our strong advice is to stop and to think and to plan carefully before we allow people back into the office. The office or the workplace, and construction sites are another good example, are places where people are going to start to come together, and what we will risk is what we're talking about in a second and a third wave. And we want to be socially responsible as IOSH professionals, and not work for organisations who've contributed to a second or third wave coming. So first of all, really clear, let's not race back into the office. And secondly, let's plan how we're going to do that. I think, did I mention earlier about lifts and elevators? Again, you know, that's going to be in big offices, that's going to be the real difficulty. How do you socially distance or physically distance at 2 meters in a lift? Well, I've worked it out in our, you know, in the majority of buildings, you won't be able to get more than 2 people in a lift in a 2 meter apart separation. So again, talk to your senior people and say, well, yeah, we can take 1,000 people back into the office, but it'll take them 6 hours to get up to their workplace because we're only now 2 at a time. So why would you possibly want to bring them back in unless you absolutely have to? And I recognize manufacturing, construction, of course, you can't make things and you can't build things from home, but in many environments you can. So, that's my advice. Don't rush back and plan. And then, of course, on IOSH website, we are providing more and more resources on how to go about that planning and return to work, and how to start building your own plans. And the last thing I'll say before I hand back, Islam, is why are we IOSH members? Because we're a network. And I can promise you, I'm working on a return to work plan for my organization. I'm sure you are, and I'm sure everyone is. Let's not all invent the same wheel. Let's share where we can. Let's share, let's work and support each other.
Thanks a lot, Tim. Any final words for the UAE membership? I know we've got more than 280 people who've tuned in to us today. Any final words from you before we move on to the AGM?
Yeah, well, first of all, I'll reiterate my thanks for being invited, and it's just amazing how many people are on. I know, we've got members from all over the world on this webinar, not just from the Middle East, but I guess just for the majority of the members in the Middle East, I know that there is still significant amount of restrictions in place. Particularly around in the UAE, but also in the other countries around in the Middle East. I also know it's Ramadan, and that, of course, itself is challenging. And obviously, as IOSH professionals, we need to understand the challenges that our colleagues who are participating in Ramadan are facing as well. We also know that Eid's coming up, and that is going to be that's quite an interesting challenge that's going to come. And of course, we want all of our Muslim colleagues to be able to celebrate Eid, one if not the most important religious events of the year. But again, it's going to be quite challenging, isn't it, in the current context? And that challenge will move into the workplace. So, during Eid, when people are going to be wanting to celebrate and hopefully doing it in a socially responsible way, but then once Eid is finished, they'll be coming into the workplace. And do we know actually quite how socially responsible our employees have been during the celebrations? I'm sure the majority are, but as ever, there'll be a small pocket of people who won't. So I guess a little challenge to you there in the Middle East is to think about how you might manage that additional risk of the post-Eid return to work, and again use the principles we've talked about today. Other than that, I'll just say thank you again. We are in IOSH. We are one great, massive global community of members. And as Andrew always says, we are the world's largest membership organization. So let's use that membership. Let's ask each other questions. Nobody has a problem that somebody else hasn't faced. Nobody has a question that somebody else hasn't been asked. And nobody has provided a solution that somebody else doesn't need. So let's use those, our networks, and let's share and support each other. Stay safe and stay well.